Good morning, everyone, and welcome to an exciting day for nursing in the Minot region and beyond. My name is Steve Shirley, and I have the privilege of serving as president at Minot State University and Dakota College at Bottineau. On behalf of the nursing programs at both Minot State and Dakota College at Bottineau, it is a privilege welcoming everyone today and announcing the extension of a major partnership between MSU-DCB and Trinity Health. As we all know, Trinity has played a vital role and has been supporting nursing education in this region for many, many decades, and specifically with this partnership for over 10 years now. With this extension of commitment that's being announced today of Trinity to provide $1.75 million in funding over the next 5 years, it will help ensure quality nursing education continues at both MSU and DCB. The funds Trinity provides has helped both MSU and DCB grow our nursing programs and educate and graduate additional nurses for our region. These are important aims for the campuses and for Trinity, but most importantly, the addition of highly qualified nurses is important for every person throughout our region. A key focus of MSU's current strategic plan is to continue and grow community partnerships to help empower future generations. And what is being announced today does exactly that. On behalf of both campuses, and specifically our nursing students, faculty, and staff, to Trinity Health, I extend a very sincere thank you and our deepest appreciation. We are grateful for your partnership and for your financial assistance these past 10 years, and we are excited about the continuation of this partnership and further collaboration as we all move forward together. The nursing profession is clearly one of the most important and most in-demand occupations throughout the nation. And there is certainly no exception to that level of importance and demand right here in our backyard in Minot and throughout central and western North Dakota. As we look out here and see all these future nurses, I congratulate all of you for making the decision that you have and choosing the profession that you have. It's an incredibly meaningful and important and rewarding career and profession. So my best wishes to all of you and congratulations on your decision. We have seen firsthand the incredible response by nurses and all healthcare workers during the past 20 months of COVID. To every nurse, everyone in healthcare, and especially to Trinity Health, we owe a huge word of gratitude and thanks for what you have done in helping to keep our community safe. The investment by Trinity Health being announced today into the MSU and DCB nursing programs will help us continue to educate and graduate outstanding, highly qualified nursing professionals. Thanks again to Trinity Health, and on behalf of both campuses, we look forward to continuing to work, to partner, and to collaborate together to enhance the quality of life in and around Minot and to address the healthcare challenges and opportunities today, tomorrow, and in the future. Thank you very much. With that, I want to call up the Vice President and Chief Nursing Officer at Trinity Health, Ms. Karen Zimmerman, to make a few comments. Karen, come on up.
Yes. Good morning. Thanks for allowing me the opportunity to be here today. And I think if you look at the banner and you see the Minot State logo and the Trinity Health logo, it's indicative and symbolic of the partnership that started over 10 years ago. And I think the beauty of what we've been able to do really should serve as a vision and inspiration for others around the state, but around the country and world, because what we've done is we've come together, the academic world and the working world, and we've identified or tried to find a way to bridge the gap that exists. You would have to live in a bubble if you didn't fully understand the nursing shortage impact around the world. And unfortunately, COVID has not had a very positive impact on nursing in terms of it has caused many more nurses to choose to leave the profession. And so I look around and I see your beautiful faces, and I'm so inspired that despite working and seeing what's been happening with the pandemic, you're still accepting the call to be a nurse, that challenge that really is a calling. It's a lifelong commitment. And what this partnership has enabled us to do is come together in one small way financially to be able to help support the faculty. And I look around and I see these women that I've known most of my career and have so much respect for, because they are helping to raise the next generation of nurses, and you are the future of nursing. What this partnership has allowed us to do is really expand space and add more faculty to be able to have more nursing students accepted into the program and be able to support each one of you with the commitment that Minot State made a long time ago to make sure that their nursing instructor to student ratio remains such that you all get the individual care and instruction that you need to help you be successful when you transition from this into the working world. And I will tell you, the students that we have from Minot State and Dakota College of Bottineau are among the best of the best. And that speaks to what you all learn and what you do here. So I just want to thank you again for allowing us this opportunity to partner with you, and know that this partnership extends while you're in school but beyond. Dr. Warren and Dr. Shirley and I, we talk constantly about the vision to make sure that we're continuing to meet your needs as students, but also make sure that you have the tools and the knowledge necessary to be successful when you step off this campus and into the world of your chosen profession. So thank you again, and it's really a pleasure to see all of you.
Thank you, Karen. I also want to acknowledge Borgie Beeler is with us. Borgie is with the Trinity Health Board of Directors, so thank you so much for being here as well today, Borgie. Thank you. Next, I want to introduce a person everyone in the room knows, Dr. April Warren. April is the chair of the MSU Nursing Department. April.
Hi, everyone. It is such a great honor to be here today and be celebrating the shared commitment between Minot State and Trinity Health. It's something that is just very near and dear to me. And on behalf of our Department of Nursing faculty and students and staff, I really want to just express our sincere appreciation for this incredible, generous support, and the support that you continue to provide to Minot State. It's such a great example to be able to further grow our program. For example, in 2016, we were admitting 18 students in the fall and 18 in the spring. And in 2017, we were able to grow that to 20 in the fall and 20 to the spring. And in 2018, we were able to grow to 24 in the fall and 24 to the spring. And it is our strategic goal to really continue to grow the program. I think we all echo that there's been just a long-standing nursing workforce shortage, and I really think the COVID pandemic has really brought to light just the importance of nursing and the important roles that they continue to play in healthcare facilities worldwide, and really just highlights the appreciation that we have for the nursing profession. The support of Trinity Health just really continues to foster a joint commitment to nursing excellence. Our students graduate from Minot State with more clinical opportunities than any other nursing program in the state of North Dakota, and that is something we're so proud of, and that is really made possible through the ongoing and comprehensive clinical opportunities provided from Trinity Health. I also must include a little personal note here and offer a special thank you to Karen Zimmerman, the Chief Nursing Officer at Trinity Health, because nearly 20 years ago, I was a new graduate in the emergency department, and that is where I first met Karen. And she was also a nurse at this time, And it was,
That means I'm old.
no, it does. It means we've been in the profession for a while. And Karen's leadership, her compassion, and her commitment to excellence was something that was just really notable from the time that I was a new graduate working in the emergency department. And her leadership continues to be very remarkable today. The resiliency to stand strong as a chief nursing officer despite the pandemic and the complexities that is created to healthcare organizations really speaks to the type of person you are. And so I am so honored to be in this partnership with you, and I really look forward to the additional possibilities that we can create. Dr. Shirley and Karen, they really echoed so many important aspects of this partnership. And in conclusion, the strength of the partnership is one that is really remarkable. And on behalf of our nursing department, nursing faculty, staff, and students, I really want to extend our tremendous appreciation for this generous support and ongoing partnership, and see what we can do to continue to strategize to create the next future of nursing. So thank you so much.
Thank you, Dr. Warren. And last but not least, I want to introduce the third partner in this representation here, and that's the campus dean at Dakota College at Bottineau, Dr. Jerry Migler. And DCB educates nurses right here in Minot, and thanks to, again, a long-standing partnership with Trinity, we have space for DCB nurses right at Trinity Health, and it works out wonderfully. So, Jerry.
Well, good morning, and a lot of the things that have been said, I'm just going to share with you what difference does this make, and I can speak for that, speak to that difference from Dakota College at Bottineau. When I first came in the fall of 2015, one of the things Dr. Shirley and I discussed was DCB assuming a leadership role for the practical nursing and associate degree programs in the Minot area. And when we started that fall, when we assumed that responsibility, I think we had about 10 students that were in the programs. Trinity Health stepped up immediately and offered space on their campus. And that was a tremendous help for launching those programs. In addition, with the support that they've provided through the program that you've heard about today, we've been able to expand from part-time staff in 6 years ago to having 4 full-time staff and part-time staff on the Trinity Health campus that are directly involved in instruction for those 2 programs. And I'm pleased to report that we have grown from about 10 students back then to close to 50 right now. And so you think about that in 6 years, what a tremendous help that has been. And it's because not only because of this program, but because of the willingness to provide space, all kinds of support behind the scenes. It's, we speak of partnerships. This is truly one that, as Karen said, really should be emulated across the state of North Dakota because it works so well and the partners work so well together. So it has made a tremendous difference for us, and more importantly, I was looking through graduation numbers, and I think you have about 60 nurses that have gone through those programs. So it works. This is a program that truly makes a difference. It works not only for the nursing students, as we have at Minot State, Dakota College, and Bottineau. It works for the college and the university, but I believe it works as equally well for Trinity Health. So thank you for your support.
Well, thanks again, everyone. This is all about all of you in your black uniforms. This is about you. You are the future. You're the future of nursing in this region, and this is about you today. So thank you all. Congratulations to you all. Thank you to all of the nursing faculty and staff at both Minot State and Dakota College at Bottineau. And really importantly, thank you very much. Let's give Trinity Health a big round of applause, everyone. Thanks for being here, and students, I'm afraid you have to go back to class now. So thanks, everyone.